today's episode, we're going to be discussing what for some folks might be considered a hot topic. In reality, we're discussing temperature dysregulation in Parkinson's disease and how that could have an impact on you as a person with Parkinson's disease, and why, especially during the hot times of the year, this could be potentially a dangerous problem to have. You're going to want to stick around till the end of the video to find out, and to find out about what you can do to prevent issues that can come along with heat or cold intolerance. Without further ado, welcome to the Parkinson's Disease Education Show. Hit it. Welcome to the Parkinson's Disease Education Show, where we demystify the disease and empower you as the person with Parkinson's disease to reach your true potential. The content contained on this show is for informational purposes only and is not meant to be a replacement for information or advice that you receive from your in-person medical or therapy professionals. If you haven't already, I hope you'll consider subscribing, and for an even more personalized experience, please ask us about our memberships. Now, without further ado, let's start the show. Well, I want to wish a warm welcome to those of you watching and listening to the episode today. Today we're going to be discussing temperature dysregulation in Parkinson's disease. Now, that's not a very well-known non-motor symptom of Parkinson's disease, but it is in fact a fairly common one. We're going to be discussing a little bit about why this happens as well as what to do about it. But by the time we reach the end of the video, I will have some practical tips for you to take home. So I think it would be prudent to talk about how the body regulates temperature in the first place, and then how Parkinson's plays a role in kind of derailing that process. So first of all, we've talked about our friend, the autonomic nervous system, before, and I know that I've mentioned that in previous videos, and you'll definitely hear about it again in future videos. The autonomic nervous system, in a nutshell, is what the brain uses to automatically take care of processes that happen whether we're awake or asleep, or whether we're aware of them or not. So our breathing, blood pressure regulation, heart rate and rhythm, I almost said constipation, the way that the gut moves and we digest food, all that happens without us thinking about it, and it's completely regulated by our central nervous system, and that is the autonomic nervous system. So the autonomic nervous system plays a direct role in temperature regulation, and it works alongside an organ in the brain called the hypothalamus. Think of the hypothalamus as the body's thermostat. So you get exposure to heat, a signal is sent up to the brain, the hypothalamus reacts to that, and you'll have reactions in the body, a signal sent out to the body to dilate blood vessels, to induce sweating, and that sort of thing. And the opposite is true. Conversely, when you have a reaction to cold, you're going to have a signal sent up to the brain, the hypothalamus reacts, sends a signal back down to the rest of the body, and that will result in reactions such as constriction of the blood vessels, shivering, and so forth. Essentially, when it's too hot, your body is going to want to get rid of excess heat. When it's colder in your environment, your body is going to want to retain that heat inside. So that's why the body is reacting the way it is to those temperature exposures. So how is all this connected with Parkinson's disease? So with Parkinson's disease, as I've said before, and we'll say again, probably many, many times, the autonomic nervous system has direct damage caused by Parkinson's disease. More details on that we can do in a future video, but suffice it to say that it has a direct impact on the autonomic nervous system in a negative way, and that's what tends to result in a lot of, if not most of, the non-motor symptoms of Parkinson's disease. So in Parkinson's disease, both the autonomic nervous system connections as well as the hypothalamus can be affected, which directly impacts temperature regulation. In those who have Lewy bodies as part of their Parkinson's diagnosis, or as a standalone Lewy body dementia diagnosis, Lewy bodies can accumulate in areas such as the hypothalamus in the brain and can cause direct impact on that area and its production of the hormones and nerve signals that are necessary for regulation of temperature. In addition to that, innervation of nerves tends to be impacted by Parkinson's disease as a disease process due to accumulation of alpha-synuclein. So when these are paired together, it completes a perfect duo for temperature dysregulation to happen. So why is this a problem? That's the obvious question. Well, the answer is fairly obvious as well. If you're going to be exposed to higher temperatures and your body is not reacting the way it should, you have a high potential for overheating, much higher than if you didn't have Parkinson's disease. And the reason for that is you may not have enough sweat production, your blood vessels may not dilate adequately, they may not respond as quickly as they should. It may take the threshold at which the reaction to a higher temperature may be altered or skewed, and therefore you may become overheated much quicker. An additional non-motor symptom that can occur alongside of this is hyperhydrosis. Ironically, hyperhydrosis, which is the fancy way of saying excess sweat production, can actually cause overheating as well. Hyperhidrosis can happen at night when sleeping, and this can cause sleep disturbances because nobody wants to wake up wet. It's very uncomfortable and it can make you feel hot. And in addition, hyperhidrosis can tend to happen more with off times. If you split between the two, it's better to have excess sweat than not enough. If you're sweating more, you'll tend to lose more heat as opposed to retaining it. When you sweat less, you're going to retain more heat, and that again puts you at higher risk for heat exhaustion or heat stroke. The opposite of that with the cold intolerance is that you can have cold hands and feet, and that can just be uncomfortable and make it feel like it's difficult to stay warm. You can kind of think of that as almost like a dystonia of the blood vessels, because the blood vessels in that case are constricting too much and retaining too much heat, which is why you get that cold hands and feet phenomena. All right, so here's some practical tips that you can use to battle dysregulation of temperature. So if you're hot or you sweat too much, these are 4 things you can do to modify that. First, you can take showers that are cooler or lukewarm to avoid getting overheated. Second tip is to stay hydrated. You don't want to get dehydrated. And again, I've talked about this in other videos. You definitely, I'm going to link that up here, you definitely want to stay hydrated with Parkinson's disease. So I'm not going to say any more about that. If you didn't know it before, you know now. Try to use clothing and or bed linens that are moisture wicking and breathe easy. So if you're thinking clothing lines, it'd be something like Under Armour or Dry Fit, something like along those lines. As far as bed linens and pajamas to look into, I would recommend Comfort Linen. I have no affiliation with Comfort Linen, but our friend David at Life with Parkinson's does have an affiliate deal with Comfort Linen, so you could potentially be helping him and his family and his channel by going to his channel. David's covered that in videos of his own, so be sure to check that out. I'll be sure to link that up above so you can see that. Not only would it help move better in bed, but it could be better for temperature regulation as well. Finally, try to avoid sweat triggers. Certain foods and chemicals can induce sweating and overheating. That includes spicy foods, caffeine, and alcohol. Some of this kind of sounds like common sense, and it is. For those with low body temperatures, you're going to want to dress in layers in the colder months especially. Even in the summer, in some cases, you might go into places that have a lot of air conditioning going on. It might be rather cold. You might be under a vent in a restaurant and it's blowing right on you. There's all kind of scenarios where you would want to dress in layers so that you can take excess layers off if you're getting too warm, but you're still insulated to keep some of that heat in. Also, limit your time outdoors in cold temperatures, especially if it's below freezing and you know it's really a risk to be outside. Try to drink a warm beverage like coffee or tea. Although not too much coffee because there's caffeine in that, but there's also caffeine in tea. Never mind. Just be careful with the caffeine intake. And finally, hand warmers can be helpful if gloves are not sufficient to hold the heat in or to make you feel like you're warm enough. Just in brief, I wanted to mention side effects that you might feel in terms of heat exposure are exhaustion, in other words, increased fatigue. You may have nausea and vomiting if you're approaching a heat exhaustion situation. You're just not going to feel well or have enough energy. So it essentially might mimic kind of an off time with medications. So you're going to want to avoid excessive heat. And it could even be a 10 or 15 degree increase in temperature. It just depends on you as an individual and how overheated you're tending to get with Parkinson's. As always, I would recommend discussing this with your movement disorder specialist if you're able to see one, in terms of potentially medications to avoid and other alternative treatment options should the tips that we talked about in this video aren't as helpful as you'd like them to be. Well, that's about all I've got for temperature dysregulation and PD. I really hope this was good information for you. Please let me know in the comments what you think, what your experience has been with temperature dysregulation and Parkinson's disease, if any. And as always, I would love for you to subscribe to the channel and consider channel memberships. That really does help us out a lot. I really look forward to seeing you in the next video. Thank you for being here today, and as always, be empowered.